Hi everyone, my name's Sean. This is another episode of Science with Sean. And today I'm going to be talking a little bit about a molecule that I think uh, is poorly understood, and there are a lot of myths associated with it, and that's the molecule testosterone. Uh, I am a biology graduate student and researcher interested in neuroendocrinology. Um, and so I think testosterone is like one of the most fascinating molecules in biology. And so there's a long history of this molecule. Now, I think when most people think of testosterone, it's just about aggression or it's about muscle mass. And I think that's only part of the story. So in this video, we're going to really rethink about what testosterone is, what it does, how effective is it, um, and what it does, not just for the body, but for the brain as well. So testosterone is really an ancient molecule. If we trace the gene for its receptor, it's called the androgen receptor or the AR gene. And so we can trace that back to well over 400 million years ago in other organisms. And we can even see certain genes for like estrogen, for example, perhaps prior to the Cambrian explosion. So this is a really ancient, important molecule that's been around for some time. And if it wasn't important, then it probably wouldn't be here with us today. So in other species, they have more of this androgen receptor gene. So they might have two genes, and some even have four genes in certain species of fish, for example. So, this type of receptor is closely related to the progesterone receptor. It's closely related to the glucocorticoid receptor, which is the receptor that works with the stress hormone that most people think about, cortisol. So it's closely related structurally to these other receptors that also play a vital role in our survival and reproduction. So um, now, in terms of what testosterone does, yes, it's important for determining whether someone's male or female. Yes, it does play a role in muscle mass and bone density, but it also plays a role in mood, motivation, and memory, especially spatial memory. So, one of the best documented cognitive sex differences between males and females is going to be spatial memory, and a lot of it can be at least partially attributed to the difference in testosterone levels between males and females. So, despite its diverse role, it kind of gets this bad reputation, or um, it gets too much of the focus put on the muscle mass, the bone density, sexual differentiation, and so forth. So, um, and then there's also some common myths that I think at least I had going into studying more about this hormone. And so I wanted to kind of talk a little bit about how those are misguided and um, just how we can have a more accurate and comprehensive view of this molecule. Now, I do want to preface that, I am not a doctor. I am not here prescribing anything or giving any kind of medical advice. I'm just reporting what a lot of studies have shown over the years and the genetic component, the evolutionary component. Um, and how it continues to play an important role in humans. So, just wanted to preface with that. Now, the first myth or common mistake that I kind of had for myself and that I see with others is that low testosterone isn't a big deal. It's actually a really big deal. It's um, frequently associated with higher levels of Alzheimer's disease. So there's that memory component, but there's also low mood, low motivation. There have been studies done on people who get prostate cancer, for example, and they go through a decreased testosterone procedure where they go through this kind of therapy that lowers their testosterone levels, and it's actually really bad in terms of like their motivation and their overall happiness. So it does seem to play a role based off of those studies as well. um, and then a second myth that I've had and kind of wondered just in general, and I think other people might have, is that testosterone doesn't really play a big role in growing muscle. It actually, this was surprising to see how much of an effect that testosterone really does have. Supplemental testosterone, not the kind that you can buy at, your local supplement store, but the actual injectable testosterone medications that are frequently used in uh, like testosterone replacement therapy in older men. So there have been some really important studies back in the 90s and early 2000s where um, they took essentially people who would receive like 50 milligrams, 125 milligrams per week to 300 milligrams to 600 milligrams, and they were able to kind of see how much an effect an increase in the testosterone had on muscle growth. And so within just 12 to 20 weeks, I mean, these people were putting on tons of muscle. I mean, uh, yeah, 10, 20, almost 30 pounds of muscle, just, and they weren't even working out in some of these studies. So, um, I mean, testosterone alone is sufficient to make significant muscle growth gains without any kind of exercise in combination with it. And so I think that really goes to show you how potent this compound is. So um, this kind of brings me to my third point is like, how safe is it? And the third myth is that testosterone is dangerous when it really isn't. So this one kind of surprised me. So when we look at low to moderate doses of testosterone, there doesn't seem to be any increased association with heart disease, prostate cancer, or other, cardiovascular health risks. So, um, like anything else, though, like even too much of like vitamin A can be bad for your health. So, of course, there's going to be diminishing returns when you go to really high super physiological levels above what's recommended medically. Um, that can definitely, I wouldn't be surprised if that were the case, but a lot of the studies that have been done are just on small to moderate levels of testosterone injections in people. So usually somewhere between 100 to 30, 300 milligrams per week is what the dosage is in a lot of these studies. So, excuse me. So, and I think it's important to show that like with bodybuilders and professional athletes, um, a lot of times they're taking way more than that testosterone replacement therapy range. So I know it's pretty common for bodybuilders to take 1,000 milligrams or 2,000 milligrams or maybe even more. Um, and oftentimes they're taking multiple drugs at once. So um, I have a big issue with studies making all these conclusions about testosterone and steroids when people are taking multiple drugs, and it's hard to really isolate to just testosterone when there's so many other variables that can affect the outcome of the study and so forth. So anyways, it appears to be relatively safe within the normal range. The normal range is somewhere between 300 milligrams to about 1,000 milligrams per deciliter within the blood. So there are like two forms there's that most people pay attention to, and that's total testosterone. That's the 300 to 1,000 milligrams per deciliter, and then you have the free testosterone range, which could play a more important role. I haven't done as much research on the difference between the two, but um, just in general, um, I think that's a pretty big deal too, to know that testosterone levels and supplementing with testosterone in small amounts can actually be really beneficial, especially as people age, because every year after 30, men tend to lose about 1% of their testosterone, their total testosterone. So by the time people get to 65, about 1 in 4 men are going to be hypogonadal, or what we would call, low T. So at that point, someone could potentially benefit from low to moderate doses of exogenous testosterone injections. So now, lifestyle does play a huge role as to what your levels are. So that's the myth number 4, that you can't really change your testosterone levels naturally. You definitely can. There are definitely things that influence testosterone, like having a high body fat percentage or a high BMI can really affect testosterone. And chronic alcohol use, significant amount of alcohol use, uh, can be a big inhibitor over time. Now, it depends what time scale you're dealing with. So immediately after a sip of alcohol, your testosterone, studies have shown, will go up a little bit. Um, but over long periods of time and great quantities, it really suppresses testosterone. So another one, and I think this is kind of an interesting evolutionary lifestyle factor, it's becoming a father. So initially, testosterone will dip for a little bit of time and then rebound after they have an infant brought into this world. So there could be some evolutionary logic there, where we come from a history of where male primates uh, uh, may not take great care of the newborn infant. And so, in order to promote their genes being carried out into the future, evolution has designed a way to mitigate that risk by dropping testosterone levels, because fathers don't need to really display aggression or display their dominance as much. They really need to take on a loving parental role that requires a different skill set. So that's something that can really lower testosterone, is becoming a father. But it looks like that is a temporary thing. After a certain amount of months, then the testosterone starts to increase again. So then poor sleep, that can also really lower testosterone. Um, Interestingly, for bodybuilders out there, low body fat, so around 5%, can drop total testosterone levels by about 70 to 75%. So that's one of the reasons why I've not decided to go into bodybuilding or anything like that. It's because of like these significant hormonal fluctuations. And of course, in terms of like the genetics and stuff like that, that does play a role too. So obviously, if you're a male versus a female, there's going to be a difference in testosterone levels typically. So, on average, there's women have about, or females have about 5 to 10% of a male's testosterone levels, total testosterone. So there's a big difference there. Um, and interestingly enough, it's not just the testosterone amount that's important. It's also people can look at the proteins or the amino acids within the androgen receptor protein and can tell based on the number of CAG repeats how sensitive you are going to be to testosterone. So it's not just the amount, but how does the body respond? How sensitive is the body to that level of testosterone that matters? So um, now that this is to kind of close this, I hope this has kind of opened people's eyes. It certainly has for me as I've started reading more about this remarkable molecule. And I just think it's important to know that, testosterone isn't a villain. It's very useful and it's been around for a long, long time. And so it's important for both the brain and the body. And it's not just a muscle molecule. It's much, much more than that. And so um, when when we talk about testosterone, I think of it more as like how do we optimize our levels, not just have this normal amount, but what does an optimal level of testosterone look like for each person? And that's just something that I don't think science is up to date enough to really make a conclusion for people. But if you found this video helpful, consider subscribing. This is another episode of Science with Sean for the relentless pursuit of truth. Thank you.